Test. Okay.
The January 22nd, 2024 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley. Mr. Blankley is present. Ms. Bonnick. Ms. Bonnick is present. Mr. Brew. Mr. Brew is present. Mr. Cruz. Mr. Cruz is present. Mr. Dondorfer. Mr. Dondorfer is present. Chairwoman Hasman. Chairwoman Hasman is present. Mr. Milne. Mr. Milne is present. Ms. Smith. Ms. Smith is present. Ms. Vasquez Simmons. Ms. Vasquez Simmons is present.
Is there anyone signed up for the public forum?
There is not.
Is there anyone present who has not signed up to speak who would like to address the committee at this time? Being none, we'll move on to the next agenda item. The next agenda item is the approval of minutes. You have the November 28th, 2023 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. Moving on to new business. The next item on the agenda is new business. Mr. Clerk.
Referral 24-0016, amend resolution 89 of 2023 to accept additional funding from the United States Children's Bureau and Office of the Administration of Children and Families through a subcontract with the University of Connecticut for improving systems and implementing interventions to support lasting reunification of families.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Is there any discussion? Thank you. Legislator Milne.
Through the chair to the administration, wondering why this is through the University of Connecticut, if that is the only university that can handle this type of support. Just wondering.
Come forward.
Please come forward.
The Children's Bureau contracts with the University of Connecticut, and then University of Connecticut, we applied to them for the grant. So the only way to receive the money is through the University of Connecticut.
And if I may, a follow-up question. So I appreciate through the chair to the administration, I appreciate the fact that you apply through the University of Connecticut. Just a local question, right? Are there not any universities in New York State or in our general area that would have a program such as this?
Through the chair, this grant is actually awarded to 5 locations across the country. There isn't anything like that locally.
Very good. Thank you. I yield the floor.
Any further discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 24-0018, authorize an intermunicipal agreement with the City of Rochester for Flower City Public Health Corps members to serve in the Monroe County Department of Public Health.
Moved by Legislator Vasquez Simmons. Seconded by Legislator Cruz and Legislator Blankley. Any discussion? Legislator Smith.
To you through the chair to the administration, if you could please answer, have we done this before in the past? And if so, how many members usually participate in this program?
This is the second year of this agreement, and we had 1 volunteer last year.
Thank you.
Any further discussion? Seeing none. Sorry, Legislator Cruz.
Through the chair, what are the qualifications of the Flower City Public Health Corps members? How would they be compensated for their work in the Monroe County Department of Public Health?
Through the chair, the City of Rochester does all the vetting of the volunteers. Folks can come in with different levels of credentials. Some folks are GED qualified, some folks have associate's degrees, some folks have master's degrees, and it really depends on their interest where they are assigned. The compensation goes directly from the City of Rochester AmeriCorps program to the volunteer. Our department receives no funds from the city. There's no exchange of funds between Monroe County and the City of Rochester for this effort.
Any further discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 24-0019, authorize an intermunicipal agreement with the City of Rochester to conduct primary lead poisoning prevention activities in city target areas for the Childhood Lead Poisoning Prevention Program.
Moved by legislator Vasquez Simmons, seconded by legislator Bonnick. Any discussion? Yes, legislator Dondorfer.
Thank you. Through the chair to the administration, what are the targeted areas of this? And are we seeing a spike in lead poisoning cases throughout Monroe County?
Through the chair, the targeted city is an identified high-risk area. There's specific zip codes within the city of Rochester, mostly what you would consider the crescent, but they are identified as that, those zip codes. As for your second question, there has been a slight increase recently, but not a definitive level of what we would call a spike yet. We haven't run 2024 numbers yet, but in 2022 is actually a lowered amount.
Through the chair to the administration, what would the numbers be in 2022?
So in 2022, the percentage overall went down with the levels of elevated lead children, but last year we have been seeing a slight increase, but our annual numbers don't get run till about halfway through the year for reporting from doctors' offices, et cetera. In order to have an accurate count, we have to wait a little bit longer. But anecdotally, through what we've been seeing, there has been a little bit of an increase of lead cases.
Through the chair to the administration, do you know what the numbers were for 2022?
Oh, no, not off the top of my head. Through the chair.
Thank you.
Legislator Smith?
Through the chair to the administration, is there a reason why you think we're seeing an uptick in 2023?
Through the chair, in 2019, the lead level for considered elevated was lowered to a 5, and we were expecting a very large increase at that time. We did start to see a slight increase there, and then COVID hit. And then there was also a recall of a machine that does finger sticks at the doctor's offices. So there was a few things that interrupted what we would have considered more of that increase. So we are thinking anecdotally that might be what we are seeing now. You're welcome.
Any further discussion? Legislator Cruz?
Through the chair, do we have any comparisons from the lead levels in the City of Rochester area, and the area this program is hoping to target as in comparison to other cities our size and population?
Through the chair, I do not have that information currently. I do not know if we have run that recently. That would be something the state would generally look at.
Question, Legislator Vasquez Simmons? Oh, I'm sorry. I thought I saw your hand go up. Any further discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 24-0020, authorize agency contracts with Finger Lakes Health Systems, Common Ground Health, and Recovery Fitness for the Monroe County Department of Public Health Addiction Services Program.
Moved by legislator Vasquez Simmons. Seconded by legislator Bonnick, legislator Blankley. Is there any discussion? Legislator Blankley.
Correct the record. I was not an additional second on that.
Oh, I'm sorry.
No, that's okay. And I do also need to declare my interest. I'm an employee of Common Ground Health.
Any other discussion? All right, seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral 24-0021, authorize a contract with DentServe Dental Services to provide dental services for residents of Monroe Community Hospital.
Moved by legislator Vasquez Simmons. Seconded by legislator Cruz. Any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral 24-0022, authorize contracts to provide temporary nursing staff at Monroe Community Hospital.
Moved by legislator Vasquez Simmons. Seconded by legislator Millman and legislator Bonnet. Any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 24-0023, acceptance of funding from the New York State Office for the Aging and authorization to contract with Lifespan of Greater Rochester for the Medicare Improvements for Patients and Providers Act.
Moved by legislator Vasquez Simmons, seconded by legislator Brew. Any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral 24-0035, acceptance of a grant from the New York State Department of Health for increasing training capacity in statewide healthcare facilities.
Moved by legislator Vasquez Simmons, seconded by legislator Smith. Any discussion? Legislator Brew.
Due to the administration, what kind of training will be the workforce receive through this grant? Do participants become CNAs, EMTs? What certifications can they reach?
Through the chair, this is a grant received by MCH. It will go towards our simulation center as well as our nurse aid training program, which we do have an internal program now. So the simulation center really is far reaching. We plan to put everyone from security guards to CNAs to LPNs to RNs through various scenarios of simulation, which can be really across the spectrum of anything training related.
Okay, thank you. And a follow-up question to the chair of the administration. So would you be also training the EMTs as well? You would not be.
Through the chair, no, we don't have any certification or license to teach and train EMTs.
Okay, thank you. You.
Any other discussion? All right, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 24-0036, acceptance of a grant from the New York State Office of Children and Family Services for the Safe Harbor Initiative for 2024.
Moved by legislator Vasquez Simmons, seconded by legislator Cruz. Any discussion? All right. Oh, yes, legislator Millman.
If I may, through the chair to the administration, do we have any key performance indicators, KPIs, we could share about the success of this program? And then a follow-up to that question will be, if we are a statewide leader for Safe Harbor, why the slight decrease in funding this year?
Through the chair, I will get an answer in terms of key indicators. Center for Youth is our lead agency on the project, and I cannot answer the question regarding why the state decreased the funding.
Very good.
Further discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 24-0042, authorize an agency contract with New York Recovery Alliance for the Monroe County Department of Public Health Addiction Services Program.
Moved by legislator Vasquez Simmons, seconded by legislator Blankley. Any discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the January 23rd, 2024 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, February 27th, 2024 at 5 p.m.